So just a quick overview of the plan for the next 55 minutes or so. We're so pleased to welcome Ann Miller with Constellation Consulting. She'll be sharing the results of the forecast social return on investment work that's been done for the Connecting People and Community work. And we'll share just a little bit about the next 3 years for the New Health Canada grant that started April the 1st. Have just a couple of resources and FYIs for you, and then our next meeting will be the 20th of June. So I will stop sharing and hand it over to Ann, who can share her presentation on the social return on investment. Welcome again, Ann, and
Thanks.
We're excited.
Yeah, hi everyone. Thanks so much for joining today. I'm just going to pull up the presentation and just let me know if you can't see it. And I think I might need to rely on somebody to monitor the chat. Oh no, I've got the chat up. Here we go. So just quickly. Yeah, so I thought we could just, I'll introduce myself. I know Helen and Sharon kind of already did that, and thank you everyone for putting your names in the chat. Then we'll just do a quick overview of the social return on investment methodology. I'm not sure how much exposure people have had to the SROI methodology, so just a quick overview of what that looks like. And in the discussion time, if you have questions about the methods, you're always welcome to bring those up. And then we'll go through the actual SROI process that was undertaken with the Connecting People and Community for Living Well project. And then we'll have time for discussion and questions. And yeah, we'll take a look at everybody's ideas around SROI. So I'm the principal consultant at Constellation Consulting Group. We specialize in research and evaluation, and then one of the methods that we use is social return on investment. And we've done social return on investment analysis with, all sorts of organizations, from very grassroots, very small scale initiatives to like big BC housing investments in developing supportive housing in BC or scattered site housing. So it can really be applied in a lot of different areas, and you're welcome to visit our website and see a few examples on there. So just a quick overview of what the SROI methodology even is. It's similar to a cost benefit analysis, but it's a little bit different. SROI is an attempt to capture sort of a fulsome look at value from different stakeholders' perspectives. So not just, costs and benefits related to government service use, but looking at what is that value to, different people impacted by the project or different communities impacted by a project. And that's social value, environmental value, economic value, and just sort of a broader look. We're also able to, through SROI, take a look at what the value of avoided alternative outcomes might be. So taking a look at, if you change a pathway or you create a particular outcome, if that means you've avoided something else, we're able to sort of incorporate the value of avoiding an alternative outcome into that assessment of value overall. One of the points of SROI that's kind of interesting to people, I think, is that in this attempt to value a broad range of outcomes for a broad range of stakeholders, we end up trying to translate some pretty social outcomes into monetary terms. So I think this is an important point in terms of the SROI ratio that you get at the end and the value that's demonstrated doesn't necessarily mean a change in an overall budget, and not all the value captured is like money in somebody's pocket at the end of the day. The financial valuation is a way to represent the value of outcomes, but oftentimes, particularly if you're seeing like cost savings for government services and systems, quite often that's more of a cost reallocation where a project like the Connecting People and Community for Living Well project might be creating value within those systems by, if somebody gets diverted from an emergency room, that frees up space for somebody, that has a broken arm or something to end up in that emergency room and see a doctor faster. So it doesn't mean necessarily that all the doctors are going to go home early, or you're going to have like a chunk of money in your budget that just went unspent. But it does mean that systems and services are operating more efficiently, and we're capturing that efficiency as sort of a cost reallocation value within the SROI. So yeah, I know some people might be interested in that, so we can also discuss that a little bit more once we're in the discussion portion. I just wanted to go over some of the ways that SROI gets used. It's sort of this broad, way to understand and quantify social value. I find it creates a really great communications bridge. So especially sort of in the social sector, I find it's a great way to communicate social outcomes in a language that governments speak and that different stakeholders speak. Board members, I often find, we'll have like, a finance sector board member look at an SROI result, and it's sort of like this aha moment around oh, this is what we mean about these social outcomes. So it creates that sort of translation of social outcomes into a different language that different stakeholders within our society are comfortable speaking. You can use SROI to forecast potential value from initiative or evaluate value from initiatives that are already underway or being evaluated. The Connecting People and Community for Living Well project was sort of set up as a forecast analysis, just because we didn't necessarily have all the data to do a fully evaluative analysis. But it is possible to do either, and kind of a combination too, like you're able to use a bit of evaluative information, then forecast some of it. But I find it can be really a great tool if you're looking forward to new projects and saying, okay, what kind of value might we expect to generate here? And that can really create like a good business case for investment in an initiative. It can also just be used internally to improve internal processes and practices. It can be used internally, to share the value of the work that's being done. So if you're speaking back to like a leadership team around a project or an initiative, you can use SROI to sort of demonstrate what the value of that initiative might be, or that time dedicated to an initiative. And internally, it can augment some of that decision-making information. So as leadership or government are trying to make decisions around how best to allocate resources, particularly in a sort of a scarcity type environment, SROI can kind of help different stakeholders understand what value is being created and sort of the value of investing in a particular initiative. The methodology is fairly new, but it does have some standardization around it through the Social Value International network. And so SROI is typically undertaken in sort of a 6-step process. The first couple of steps are very similar to what you might do in an evaluation, where you're looking at the scope, like what's the time frame that we'll be analyzing, identifying who the stakeholders are within that analysis, mapping out the different outcomes that different stakeholders might be experiencing. This often looks very similar to developing a program logic model. And then in step 3, we sort of divert into the SROI world, where we'll look at how you can get evidence around those outcomes, but also what the value of those outcomes would be. So how do you assign how do you understand what the value of a particular outcome is? And then how do you understand how many people or communities or how many times that outcome is happening? The next step, step 4, establishing impact, is really, I find it sort of the take a step back step. So this is the point at which we take a look at the outcomes that we've mapped and sort of the evidence that we might have around achievement of outcomes. And we try and really, it's like a reality check around making sure we're not overclaiming the value that we're calculating. So taking a look at whether the change might have happened anyway, the outcome, whether the outcomes that are being created are displacing other positive outcomes that might be happening in the community, whether there are other initiatives or groups contributing to an outcome that's happening. And if there's, if the outcome is sort of enduring into the future, whether it's dropping off over time, like if you learn something new at a workshop, are you still using that skill 5 years from now, or have you sort of moved on to different things or forgotten about it? So yeah, that taking a step back step is really important, and we discount all the value based on those different factors. Then there's the actual calculating of the SROI ratio. So this is where we look at the total value of all the outcomes, divide it by the total investment, reduce based on that those impact discounts. And then we end up with a ratio that you can report and use in those different ways that I already mentioned. So the ratio in the end is expressed as 1 to something, which ends up meaning for every dollar invested, however much is created in social and economic value. So if you had an SROI ratio of 1 to 3, for example, it would mean that for every dollar invested, there's $3 in social and economic value created. And then you can break that out in different ways and understand, which stakeholders are experiencing that value, or where it's coming from exactly, what elements of a project might be sort of a value add. Sometimes you can break that out. So once you have that ratio, you can look at it in different ways. So now I'll jump into the Connecting People and Community for Living Well project SROI process. So those 6 steps that I mentioned, I'll just go through what that looked like for this project, and then we can see the SROI results. So we ended up looking at the time frame of March 2022 to March 2023. So that means all the investment in that time period was accounted for in the SROI, and all the outcomes that might have been created in that time period. We did sort of a blended forecast and evaluative analysis, as I mentioned earlier, where anywhere where there was sort of actual evaluation data, we were able to leverage that. But we also did some forecasting. We looked at the ROI study and used some of the data out of there. And then anywhere where we didn't have the data that we needed, we did some forecasting based on research or based on some of the preliminary evidence that might have come out of the evaluation. And within the SROI analysis, the stakeholders that we identified were, the people living with dementia in rural communities being really that primary stakeholder, and then the caregivers for those people being sort of tied together there. We also looked at members of the multi-sector community teams, so a lot of the folks on the call today as being a stakeholder within the analysis. Other community-based organizations in some of the communities where the project is taking place, the communities themselves being impacted as a stakeholder, and then government systems and services. So that last category was broader than just health systems and services. We were looking at, overall, the health systems definitely in there, but sort of all the systems that people might touch as they work through a diagnosis of dementia. So in terms of the next step, mapping the outcomes, We mapped the outcomes based on, some review of existing research, past assessments of the value of the project, so those ROI studies, some review of the information generated by the evaluation, and then some of the perspectives shared by stakeholders during the evaluation. So I know all the team members that have been contributing, that information was able to feed into how we set up the SROI, and then perspectives shared by Helen and Sharon in their sort of experience working with the project and working through the project. So now I've got these very text heavy slides, and when we send out the slides, you can probably go through this in a little more detail. I just want to make sure they're all in there, and they're in the report as well. But for each stakeholder group, we mapped a set of different outcomes that we then tried to value in the SROI. So there were outcomes for people living with dementia in rural communities. There were outcomes for caregivers, like around increased well-being, decreased time and resource spent caring or in that caregiver role, increased inclusion, those sorts of things. We mapped as well outcomes for members of the multi-sector community teams. So just some of those connection pieces and knowledge pieces that hopefully, as you're looking at this, you think, yeah, I think that happened because of the project. Also looking at outcomes for other community-based organizations that might be impacted. So again, sort of that awareness around dementia and creating a community that's better able to serve people living with dementia and their caregivers. And then outcomes for rural communities, moving up a level and looking at the benefits that the project might be having in terms of accessibility and inclusiveness, understanding. And then the last piece being, there's just so much text on here, and hopefully you can go through it in your own time. I know it's too much probably to read right now, but looking at the ways in which the outcomes that people in communities might be experiencing would then impact publicly funded services and systems. So healthcare systems, social systems, those sorts of pieces. So then looking at how many people or groups might be experiencing some of these outcomes, so the evidencing outcome step, we looked to some existing research, some of the evaluation data again, the ROI data again, and where there wasn't data or research or or anything, there were conservative estimates made. So that's that forecasting piece. And then in terms of valuing those outcomes, looking at each outcome and determining how to represent that outcome in financial terms. We looked at similar SROI studies, quite a few, sort of coming out of the UK. We used some of the ROI data that was very helpful in terms of understanding health system costs. And then publicly available cost data. So there's quite a bit out there that we were able to leverage to include in the SROI. Then we went through and did the discounts around dead weight, displacement, attribution, and drop-off. These were all estimated, again, using evaluation findings, some existing research, and if anything, if there were places where it didn't exist, reasonable estimations with sort of an explanation as to what that estimation might have been. So the moment people have been waiting for, the actual SROI results. So the SROI analysis revealed an SROI ratio of 1 to 6.34. So this suggests that the Connecting People and Community for Living Well project creates just over $6 in social and economic value for every dollar that's invested in making the project happen, which is a really great return. It's very much in line with what similar projects or kind of comparable type projects, because there isn't really, we didn't find an SROI on something, directly the same, but similar types of projects are creating this type of value. So that was really great to see. And then looking at this value, breaking it out across stakeholder groups, we found that the outcomes experienced by people living with dementia and their caregivers accounted for about 45% of the value. So that's value going right back to people through increased well-being, through increased inclusion, decreased stress and anxiety, all those sorts of impacts that are happening at that individual level are creating a lot of value for people. Another 45% of the value is also calculated to go back to publicly funded services and systems. And as I mentioned before, it's not just the healthcare system. It's sort of a little bit broader than that. And then there was also a chunk of value going back to the teams involved in the project. So about 6% of the value going back to the teams based on the support that was provided through the project and, new ways of working, things like that. And about 4% of the value going back to the communities as a whole through that overall increase in inclusivity, understanding, awareness, and just sort of a system that's functioning a little bit better because of the project. And I think the results are really exciting because, well, for one thing, they're very positive, but I think it also is exciting because it's sort of a demonstration that value can be created for people living with dementia, and it doesn't have to be a medical model. Creating value for the healthcare system doesn't have to come from changing ways, changing medications or changing, hospital procedures. Working at the community level can really impact people in a positive way that creates a lot of value for individuals, systems, and communities. And looking at this value, I think it's important to recognize as well that the value that's created is probably actually a bit higher than what we've been able to capture in the SROI analysis, particularly because in the SROI analysis, we're never able to capture all of the value for all of the stakeholders. So particularly some of those intangible sorts of changes, like increased hope or decreased experiences of stigmatization. These things are really difficult to capture in financial terms, so they're probably a bit undervalued within the SROI analysis. The SROI also doesn't totally capture the value of the project's impact on home care in communities. It hasn't captured like the impact on systems of being able to better respond to community need. We didn't do a lot of speculation about the long-term impact of the project. We were looking pretty short-term. And so we did some sensitivity tests around like, if these outcomes lasted longer without any further investment, what sort of value would be created? And it's actually quite a lot higher. So we've taken a pretty conservative approach. And then as well, whenever we're looking at the value of different outcomes, as we're doing that research, there's often a bit of a range of what that value could be. And throughout the analysis, we took usually the lowest or pretty close to the lowest value within that range to be included in the SROI analysis, just to make sure we were being conservative in this estimate of values. So overall, it's a fairly conservative estimate of value. We did some sensitivity tests. Most came back a bit higher. And so I think that's all really positive in terms of demonstrating the impact and the value of the project. That was all from me. I would love to have a chat, a discussion. Yeah, I don't know, Sharon and Helen, were you thinking people would jump in and talk, raise hands, chat in the chat box, all of the above?
I think all of the above, and yeah,
Awesome.
you bet. So if you have questions for Anne about the process or results, you know, feel free to either put your hand up or take yourself off mute, or pop it into the chat box as you're comfortable. I think just while we're waiting for that, you know, one of the things that led us down this path with Anne for the social return on investment, you know, we have been hearing over the course of the past 6 or so years that we've been involved in this work, the different things that are happening in the community that, you know, aren't necessarily, people aren't showing up in the emergency department, but we know there is things that are things happening in the community that are going really well. And so part of our reasoning was to kind of uncover some of those other things happening in the community that weren't so healthcare system focused. So I think this is really exciting for us as this project, as near as we can tell, has been the first SROI in Alberta Health Services to be completed. So we want to thank Anne for helping us on this inaugural run. Arlene Hun, I see your hand up there.
Yes, thanks. And I just have a question. So you showed the slide that the return on investment was for every dollar spent, there were kind of $6 worth of. So is that like I look and I go, wow, is that actually a wow factor? Or I'm not sure why I'm spotlighted now, but is that a wow factor, or is that just me? And I guess what I'm trying to say is, when you think of social services, is that a really good return on investment? Because I thought it was, but just wondering from your perspective.
Yeah, for sure. Yeah, I think it really is. I always tell people anything 1-to-1 or above is really great. Because a 1-to-1 would show that, you know, you're using a different model and you're getting an equal value. And so if there's, you know, some intangible value that's not captured, you're probably getting more value. And so a 6-to-1 is really actually quite good. And I think as well, it's sort of in line with what the ROI showed. So the chunk of value that's going back to government services in the system is very similar within the SROI, but we were able to do a bit of a broader capture. So there's value for people beyond what the value might be for government. And so I think that's where you get that value add, and it's really exciting to see that.
And I guess my second part of the question is, I just find it interesting because anytime, you know, we've done work with the government, it's always been like, well, how can you prove the work you do actually is valuable, right? And so does it take a certain size of study to come up with those numbers, or can this kind of a study kind of be done in a smaller scale? So, you know, I think of, you know, there were so many projects kind of in this bigger one. What if we just did one project? Would we still kind of see those same results? Then I'm done, you guys. Thanks.
Yeah, you probably should see similar results, even if you looked at just one community, because if you're looking at just one community, you would look at just the outcomes for that community, but also just the investment for that community. So it wouldn't be the total project budget. So you'd probably see a similar return. It would probably vary a little bit community to community. And I think I mentioned in the presentation that SROI can really be done at all sorts of different levels. I really like to see it done at the grassroots community level, because I think you can really see the connections there. When it's done at the like higher policy level, it's like a little bit more intangible, I guess, or just a little bit harder to see those connections. But yeah, it can be done at whatever level. And I think if you did it at your own community level, you would see something similar.
Perfect. Thanks for that, Anne.
Yeah. Then I
Thanks for your questions, Arlene.
Comment here from Heather: looking beyond the dollars of the healthcare system is valuable. And so I appreciate that comment. I think as well, seeing that value add is really helpful. And we've got, I think, Marlene.
Marlene, you have a question.
And a cat.
Yeah, the cat is here too, so that'll be where the most interesting comes from. I really appreciate this presentation. I'm a volunteer with the Alberta Association of Gerontology. I live in I live in Airdrie, and I think about Airdrie whenever I'm not doing the provincial work. I'm very appreciative of the thinking here, because we have the benefit with AAG and Healthy Aging Alberta to be working on a project together that's looking at mapping cross-sectoral implications and applications of work like we're talking about. So Sharon and Helen, I'm starting to do a little inventory, an environmental scan around outcomes that matter, things that we need to think about. And one of the opportunities, to your point, Arlene, we can only dream about this, but maybe we can inch closer, that we can begin to learn from each other and develop a framework of some common metrics of success, and then we can use them in the various ways. That is important, an important outcome of the project that we're working at with Healthy Aging Alberta. Will we get it figured out? No, I'm not concerned about figuring it out for September, but it's an area of further and exploration that's very important to the journey we're on. And the other piece that I wanted to say, I'm so pleased about the scope of what you're looking at, the publicly funded services. Everyone's interested in making better use of what we do, so that's good. But what's really interesting here are the outcomes that matter to people living with dementia. And the other piece was the interdisciplinary team. We're talking about an area of workforce trouble. We're all in trouble. So how can we create new ways of working that actually make it fun to work? And then you'd come to work, or you'd want to work. So I want to thank you for this and really look forward to getting the slides and to further conversations, Sharon and Helen, because you're closest to the project that I spoke about.
Yeah, thanks so much for your reflections, Marlene. Any other comments or questions?
I was just going to reflect as we've heard the results before, but just as hearing the presentation today, it's been really reinforcing across the different types of evaluation. I think it's important that we have different ways of looking at it to see that, by supporting those community level teams, we are having an impact on the individual lives of people.
Mm-hmm.
And I think we've seen that throughout every type of evaluation, which we've done. I think it's 4 or 5 types, for this project. And so I think that's really a key, strong finding that is coming forward.
Mm-hmm. I think what I love, just building on that, Helen, is, the folks in the multi-sector community teams that are involved in this work, their number one raison d'etre that they share in terms of being involved in that is to have a positive impact on those in their community. And that in this context of this project, that the 45% combination of people living with dementia and cares is equivalent to that publicly funded system, which is a beautiful thing, right? It demonstrates, I think, and I would love to know from those on the teams, but I think it provides some validity to, they came into this work hoping to support this particular population in their communities, and this is showing that there is some value in that. So I think that's beautiful, because in a health system utilization one, that doesn't come out. It isn't teased out in the results. So I think your point around, there's value for the healthcare system that happens outside of the medical model. And I think this just really helps to build that evidence that it does matter to invest in things like this for multiple parties. Any other questions or comments? Okay. So yeah, thanks, Arlene. Oh, that's great, Linda.
Yeah.
As a carer, good to hear directly. Okay, wonderful. So the slide deck that Anne shared will come out when Kate shares the recording as well. We'll share a copy of the report so that there's a more comprehensive look at the results that Anne shared if that's of interest. And I think, Anne, your contact information is in the slide deck if people have questions specifically for you.
Yeah, and everyone or anyone is free to connect with me, chat further about the methodology or the results. Yeah, like Sharon said, my contact information is at the end of the slides there. Yeah, and once you see the full report, it has more details about sort of how the analysis was completed and what's included. So you might have more questions at that point.
Mm-hmm. You know, our teams are great at letting us know what they need information for. And I think some of this is helpful for them, you know, as they look for grant applications or different things like that, and even decision-making for those local community partners that are involved. So just seeing a comment from Ellen here, fantastic results. I like to see that this information is another way to show what we're doing through coalitions and services can be used to help with funding or staffing. Thanks, Anne. Yeah, thanks, Ellen. As you said, Marlene, that workforce challenge that is we're becoming increasingly aware of. Okay, wonderful. Well, thanks so much, Anne. Really great. I know we'll come back to you with questions too. So
yeah, thank you so much for inviting me into this project to look at the work, because it's been really really interesting, really positive results, and great to work with a team that's looking at things in a little bit of a different way. It's yeah, it's been a really great learning experience for me too.
Awesome. And more to come, because as we slip into what will be the next 3 years of the Health Canada grant work, we'll continue our work with Constellation Consulting. The results that Anne just presented, as she said, were with that forecast SROI, and over the course then of the next 3 years, there will be an evaluative SROI that's completed. So for the communities that are participating in this work over the next 3 years, we'll have a little bit more information under our belts that can look at that evaluative SROI. So more to come. You'll be back in this Zoom room at some point, I think, Anne. Okay. Let's see if I can get my screen sorted out here to share. So as I mentioned at the beginning, we're just starting now into the next 3 years of the Health Canada grant. So it began the 1st of April, and we're just nicely getting started. Some of you, we didn't have the chance at the beginning to do a round of introductions, but some of you may recognize the face of Katie Kirshner. Katie was Kirshner when she was with us the first time. She's Katie Mellon now, and she's just joined us. This is week 2 back in the project. You may recall her involvement in the work prior to this, when she supported the development of those pandemic response case studies, as well as other activities associated with the Health Canada grant. So we're just building up the next portion of our team. Katie has joined us last week, and we're also in the process of bringing on a research coordinator to support with the applied research elements of the grant next 3 years as well. So what the next 3 years will build on really is the learning of the past couple of years, and really 5 kind of key activities that will take place. The first is the sustain activities, which really is looking at the communities that participated in the grant that ended just the end of March. What kinds of things are needed in an ongoing way to support sustaining that local level? We hear over and over again of the stop-start momentum that can happen in communities who are doing this type of work when they're reliant on grant funding that stops and starts as well. So wanting to be able to use the well-being guide and competency framework to kind of inform what else is needed at that local level to help sustain that. So the second part is the spread. So taking the model that's been developed, using that well-being guide and competency framework with additional rural communities to who are looking to serve and support those affected by dementia. So again, similar to this last grant, the persons living with dementia as well as the carers. The third part is where that applied research component comes in, and it's taking the model and our sense over the time and what we have heard from teams as well is that they can see how talking through and understanding those local resources can be valuable to populations other than those living with dementia and carers. So what we're wanting to do then in a more formal way through applied research activities is understanding what additional underserved populations the model might be supportive for. The focus will still be in rural communities. And job one of our research coordinator when they start will be to dig into the data around what are those underserved populations in the province of Alberta. And then as we engage with communities who are interested in participating in the work, looking at those Alberta underserved populations and what might that look like in their own community. So there's a couple of examples on the slide here, but it could be a subset of a particular population as well, but getting to know kind of the local demographics within that community and who might be those most underserved. And so that,
Sharon, sorry, we just can't see the slide deck.
Yeah, you're not sharing.
Well, it looks like I am on my end. Isn't that weird? Okay, let me stop sharing and try sharing again. I've been doing a lot of talking without you seeing my slide. Interesting. Okay, let's go for round 2.
Now we
seeing anything else? Okay, well, thanks for letting me know. All right. Okay, so just talking about that scale portion here. So again, looking at up to 5 more communities to support in that regard. The next part is just around that knowledge translation, knowledge dissemination. So understanding that the work is unique, wanting to be able to add to that evidence base in the out in the ether around that. So still looking to do more kind of presentations and create broader awareness around that. One of the other parts in this particular activity will be around policy and infrastructure. So what I think anyone who is involved in this work at that local level recognizes that decisions that are made at that kind of broader system level certainly impact the sustainability and how successful those local teams can be in advancing their own priorities locally. So doing some policy scan work to understand what policies are in place, both provincially, nationally, and then internationally as well, that either support this type of work or may kind of stand in the way of sustainable efforts at that local level. And then what are some of those infrastructure things too, whether we look at funding flows or how funding models are structured, even things like grant timeframes, et cetera. What are some of those kind of infrastructure things that are needed? So making some recommendations. The work again is funded through the Health Canada policy arm. So really leveraging our relationship with the policy departments within Health Canada to help support this end of it as well, because that's part of what they're wanting to learn from the grant as well. So, and then the last part brings us back to what, building on what Anne has shared, but certainly that evaluation component of it, and then the evaluative social return on investment that will expand on the work that Anne's already done. Any questions on this part? Okay. I'll just check in. You can still see the deck? Okay, yeah. I'm seeing some nodding and thumbs up. Now I'm a little bit like, how come I'm, okay. So this is just a snapshot of the timeline for those three kind of sustain, spread, and scale options. The work with the sustained communities focusing on kind of continuing on what they had started in the first round, and spread doing what in other communities what's happened, and then that scale will be that applied research activity. So the first kind of year and a half, we'll be looking at that research activities and performing some focus groups on those underserved populations then that are identified in the communities that will be participating. The Wellbeing Guide in its current state will be revised then to reflect learnings from that applied research, and then we'll slip into the Wellbeing Guide completion within those communities. So there's seed funding that will be available for each one of these streams of activities. Until we land on the number of communities, we won't know the specific amount, but somewhere in the ballpark of the seed funding that's been provided in these last couple of years. And then taking us through then till the end of March of 2026. So if there are questions that you have more specifically about the streams over the next couple of weeks, a month, we'll have met with all of the teams that were participating in the last grant to talk about opportunities in this next one. As well, if there are those on the line who might know of communities who are advancing this type of work and would be interested in participating, we welcome any questions. Please just refer them to any of us on the team. We're happy to meet and talk about the work and more importantly, kind of understand how it fits in with the work that's already happening in your communities. Okay, resources, just a couple here. And I think actually, Helen, I'm going to hand this over to you because I think these are ones that you dug up, were they?
Yes, I think that's right. That came through email that I received from that Canadian Dementia Learning and Resource Network. So it's a national organization. And this one, I think, is an overview of these different projects and what their innovative tools and resources have been. So it's to be able to learn from other people across the country in the work that they're doing.
Great, thanks, Helen. Linda, I see your question. Are the Wellbeing Guides available to people like me? So yes, the Wellbeing Guide is available online. And I wonder, Kate, maybe if you wouldn't mind popping the link to our website in the chat box. When you land onto the landing page, it comes up in the, I think it's called Resource Bundle. Is that what the WELL is? Yeah.
Yes. Yeah.
And if you click in Resource Bundle, you'll see in there a number of different things, but one of them is the Wellbeing Guide. So you can have a look at it through there. Thanks for that question, Linda. Which is another plug, I guess, for our webpage that's been recently been updated. We had stopped sharing it there for a while because it was in need of an update. So, all right. A couple of events. Again, Helen, I think I'll leave this in your hands. You're doing a great job with the resources and FYIs.
Sure. So again, this is an information session, that first one, the research break. And so that's able to join virtually on the 30th there, again, to learn more about that. And then the last one actually we had shared, I think, by a number of different places, but there's 2 online consultations, May 31st and June 1st, to kind of learn from each other as service providers, running intergenerational group with older adults and individuals living with dementia. So they're looking to have some information from the people who are doing this work. Back to you, Sharon.
Great, thanks, Helen. Okay, no plug necessary. Here it is in bold on the screen, our new website. So just point out at the bottom kind of on the left-hand side there, whoops, is the model and resource bundle where the well-being guide is. But still a lot of similarity. The local stories and pandemic response case studies are still there, and then some different results as well that have come through. The evaluation team that presented at last month's meeting, once that final evaluation report is complete, that will also be available on here. So we'll keep folks posted on updates there. And a reminder around the open group for the Connecting People and Community for Living Well on the Healthy Aging Core webpage. And that's it. We'll stop sharing and just see if there's any other questions or comments from anyone on the line.
Or
Okay.
any other announcements.
Yes, or any
Yeah,
other
yeah.
announcements. That's right. Okay. Well, thank you everyone for taking the time out of your day to join us, and thank you again for coming and sharing the results of the SROI. Much appreciated. And we'll send everyone off onto their day. Stay well, and we'll talk again in June.
Thanks.
Thanks, everyone.
Thanks, everyone.
Right.
Thanks.